New research is linking wildfires to an increased risk of dementia, and that's especially concerning if you look at this chart. This is posted by CAL FIRE. More than 750,000 acres have already burned in this state this year. That is way above last year, and yes, it is only August. Here now, Fox 11 medical contributor Dr. Michael Daignault, also an emergency physician at Providence Little Company of Mary and Torrance. Welcome back. You've been on vacation. We've missed you.
I missed you too.
We don't feel as healthy without you. It's time to get healthy again.
That's right. We've got a lot to cover.
We do. Okay, so wildfire smoke exposure linked with higher risk of dementia. Why?
I know this was really scary to see this. This was a massive study done by Kaiser of its members, and of 1.2 million members, and they found that there was an increase by 21% in the rates of dementia in those exposed to wildfire. What was really concerning about this study is when we talk about pollution, whether it's from wildfire or just our air pollution in LA, we're talking about particle pollution, and it's a high concentration of particles that are in the wildfire that I think is contributing to this. And you know, you talk about people with asthma and chronic respiratory disease that always have more difficulty when there's a wildfire, whether it's up north or here. But in this case, there's something that's happening with those particles. They're getting into our system, and they're causing all sorts of chronic inflammation that may be contributing to dementia. So people in that area, it's really important to get a air purifier for indoors, and if you're going to go outside, to wear an N95, the N95 mask that we have from the pandemic.
Reduce your exposure.
Right.
Now, how much is the increased risk? Is it 21%?
21%. And so with air pollution, it's about 4%. So this is a huge jump. And again, the issue is it doesn't take much. So just a little bit of wildfire, just because it's highly concentrated of particle pollution versus the air pollution here.
And you know, I'm thinking of all of our firefighters too.
Right, I know, and
this is what they do for a living.
Right, and we're going to need more studies, and we're going to have to pay more attention to this going forward.
Okay, moving on to this. This is Gen X and Millennials. They are showing higher rates of 17 cancers than older generations. Why?
You know, we've talked about this many times on here, how we're seeing increased rates of certain cancers, and I want to pay particular attention to two, colorectal cancer and endometrial cancer, which is cancer of the lining of the uterus in women. And so, you know, this study was a massive study from Lancet Journal, and some of the reasons they looked at as possible causes, obesity, it's the cause of 20% of cancers in this country right now, a sedentary lifestyle, and then we talk about like chemical exposure. So the authors of the study were considering whether it's chemicals in the water, in the foods, like highly processed, ultra-processed foods are certainly probably contributing to this, and also the overuse and overprescription of antibiotics, because it affects the gut biome, and that could be contributing to more rates of colorectal cancer. So it's really important to have a primary care doctor. If you're 45, to get that colorectal cancer screening with a colonoscopy. If you're a woman, there's no screening test for endometrial cancer, but it's usually abnormal vaginal bleeding, pain during intercourse, and you really need to make sure you follow up with your gynecologist every year if you have those symptoms.
Yeah. Very important. I'm also hearing you say you need to get outside, get off the screens, get some exercise, live a healthier lifestyle.
Common themes. We've said that many times.
Yes, we have. Okay, so you have been back from vacation for about a week, so you're back in the ER, and you're seeing more cases of kidney stones right now?
Yeah, so, you know, just based on my own anecdotal experience, I'm like, why are there so many more patients coming in with kidney stones now than when I started work, you know, 10 years ago? And I did some research, and there is some truth to that. So, late 1970s, just to give you some perspective, about 4% of the population had kidney stones. Now it's about 10%. And when people come to the ER with kidney stone, it's severe flank pain, radiating to the front, difficulty urinating. They might have kidney failure. They might also have a urinary tract or kidney infection on top of it. We treat with pain medications. Sometimes they require a stent to open up the ureter and allow the stone to pass. And so a lot of times patients will say, what can I do to prevent this from happening again? And so the #1 cause is dehydration. People aren't drinking enough water. Then we start to look at diet. So it's an increase in the amount, again, of ultra-processed foods, sodium, sugar, sedentary lifestyle, and also people not having enough calcium in their diet, because the main ingredient of kidney stones is calcium oxalate. And so it seems counterintuitive to have more calcium, but if you have more calcium in your diet, it binds to the oxalate, and it allows you to excrete that calcium in your bowel movements rather than passing through the urine and contributing to kidney stones. So drink more water, calcium-rich foods, exercise, don't be sedentary. I mean, it's the same themes. We talked about how to prevent these rates of cancer.
Common sense, right? right? Okay. I wish it was coming. If you want your question answered by Dr. Daignault, you can send an email to askthedoctor@fox.com, or you can find him on Instagram at
Dr. Daignault.
Dr. Daignault. Okay. Thank you so much.
Thank you.
That was really enlightening. Alex.